Substance addictions. Substance addictions are conditions where drugs or alcohol change how the brain handles reward and self-control. Common examples are alcohol, nicotine, opioids like heroin or painkillers, stimulants like cocaine or meth, cannabis, and sedatives like Valium. Over time, people often need more to feel the same effect, and stopping can cause withdrawal. The brain starts to depend on the substance for pleasure and balance. Everyday activities that once brought joy, such as hobbies or social time, may feel dull without the drug. Risk increases with family history, early use, trauma, stress, and mental health issues like anxiety or depression. Social factors such as peer pressure, loneliness, or unstable living conditions also increase vulnerability. Treatment usually combines medicine, therapy, and strong social support. Helpful tools include methadone or buprenorphine for opioids, naltrexone or acamprosate for alcohol, and nicotine replacement for tobacco. Counseling, peer groups, and new daily routines are key to long-term recovery. Building structure, physical health, and purpose helps prevent relapse. Alcohol problems affect hundreds of millions worldwide, and drug problems affect tens of millions. Both create lasting health, family, and financial challenges. Behavioral addictions. These addictions do not involve drugs or alcohol, but the behavior itself becomes hard to stop because it feels rewarding. The brain releases dopamine, the same feel-good chemical triggered by drugs, creating strong urges to repeat the behavior. Common examples include gambling, video games, shopping, pornography, or excessive use of social media. People may spend more time or money than planned, lie about their use, or neglect work, school, and relationships. What starts as a way to relax or escape can become a daily habit that feels impossible to control. Over time, this pattern can lead to stress, guilt, or financial and emotional problems. Causes often include stress relief, impulsivity, boredom, and easy access to rewards through phones or apps. Treatment focuses on therapy, such as CBT, to identify triggers and develop new coping skills. Motivational interviewing helps people strengthen commitment to change. Support groups, both online and in person, provide understanding and accountability. Process addictions. This term refers to addictions involving repeated behaviors rather than substances. Examples include binge eating, overworking, overexercising, or compulsive sexual behavior. The cycle usually starts with a trigger like stress or loneliness, followed by a short burst of relief or pleasure, then guilt or shame afterward. The person promises to stop but repeats the cycle when emotions build again. These behaviors can interfere with relationships, work, and self-esteem. Some people use them to escape negative feelings or gain a sense of control. Treatment is similar to that for other behavioral addictions and often includes CBT, mindfulness, and learning to manage emotions. Exposure therapy, where someone safely faces triggers without acting on urges, can also help. Joining support groups like Overeaters Anonymous or Sex Addicts. Anonymous provides community support. Lifestyle changes, such as better sleep, exercise, and social balance, also reduce relapse risk. Impulse control disorders. These involve strong urges that are difficult to stop, even when they cause harm. Examples include kleptomania, stealing, pyromania, fire setting, and intermittent explosive disorder, sudden anger outbursts. People often feel tension before acting and relief afterward. Unlike addictions, the goal is not pleasure, but escape from stress or pressure. These conditions may be linked to brain chemistry, trauma, or other mental health problems. They can cause legal or relationship difficulties if untreated. Therapy focuses on impulse management, problem solving, and emotional regulation. CBT helps people spot early warning signs and use healthier responses. In some cases, medications such as antidepressants, mood stabilizers, or naltrexone help reduce urges. Family education is also important, since these issues often affect others around the person. Early help improves outcomes and prevents long-term harm. Dual diagnosis. Many people with addiction also have another mental health condition such as depression, anxiety, bipolar disorder, or PTSD. Each can worsen the other. Someone may drink or use drugs to numb sadness or fear, but substance use can deepen those feelings. This cycle makes recovery harder. Integrated care is best, meaning both issues are treated together. Therapy, medicine, and strong social support work best when coordinated. Motivational interviewing, CBT, DBT, and trauma-informed therapy are common approaches. Support groups and peer mentors who understand both challenges can reduce stigma and isolation. Doctors also screen for suicide risk, infections, and medical complications. About half of people with serious mental illness have a substance use disorder at some point, but recovery improves when both are treated at once. Cross-addiction, also called substitution addiction, this happens when a person recovers from one addiction but develops another. Someone may quit drinking but start gambling, or stop using drugs but become obsessed with work or exercise. The underlying vulnerability remains because the brain still craves stimulation and comfort. Prevention starts with awareness and balanced daily habits. Building new routines that include sleep, physical activity, hobbies, and connection helps fill the gap. Support networks and therapy help people spot early warning signs. Families can notice secrecy, big mood shifts, or sudden changes in spending. If substitution occurs, it needs treatment just like the first addiction. Recovery skills can transfer between problems, helping people regain balance and control over time. Polysubstance dependence. This means being addicted to more than one substance at once. Some mix alcohol with cocaine to balance highs and lows, or opioids with sedatives to calm down. Combining drugs increases overdose risk, especially when depressants are mixed. Treatment starts with full medical evaluation, since detox may require close supervision. Each substance has its own withdrawal pattern and risks. Medications can ease symptoms and support recovery, but long-term success depends on addressing the overall pattern of use. Therapy helps people understand triggers, cope with stress, and rebuild a healthy lifestyle. Group therapy and family support improve results. Since most people in treatment use more than one substance, flexible, individualized plans are essential. Time-based addictions. These center on how much time is lost rather than on physical harm. Common examples include endless scrolling on social media, binge-watching shows, or spending hours gaming or browsing online. Technology platforms are designed to keep attention using likes, streaks, and autoplay features. People often plan to spend a few minutes and lose hours instead. The cost includes poor sleep, low energy, stress, and less time for real-life goals. Overuse can also lead to loneliness, anxiety, or decreased focus. Managing this type of addiction starts with awareness. Setting limits, turning off notifications, and scheduling device-free times helps. Apps that track or block screen time can also support change. CBT techniques teach how to identify emotional triggers and replace them with healthy activities like going outside, talking to friends, or learning something new. Replacing passive screen time with active engagement improves mood and self-control. Small daily changes restore balance, focus, and time for meaningful life activities.